there. Last week, a worried mother came to my clinic who was extremely concerned about her daughter's hair fall. Yesterday, an elderly man was complaining about his severe weakness. Today morning, I got a call from my relative saying that her TSH level is 20. Do you know what is common in all these three scenarios? Yes, you guessed it right. It's thyroid disease. In today's video, I'll be talking about this common thyroid condition, hypothyroidism, in detail. Let's begin with the basics. Thyroid gland is a butterfly-shaped gland which is situated in front of the neck. This gland produces thyroid hormones which is required for our body's metabolism. In a person who is suffering from hypothyroidism, he develops various symptoms. Before that, what is hypothyroidism? The word hypo stands for less or underactive. Here the thyroid gland is underactive. The thyroid gland is not making enough hormones for the body. What are the symptoms of hypothyroidism? Feeling tired, easily getting cold, hair fall, gaining weight, getting constipated, depression, low mood. It can also make your heartbeat go less, accumulation of water in the body. It can cause swelling in your legs, puffiness around your eyes. In ladies, hypothyroidism can cause irregular periods. They can have difficulty in becoming pregnant. Hypothyroidism can cause miscarriage in those who are pregnant. In elderly people, they can cause severe body aches, muscle pains, difficulty in walking, tiredness. So these are some of the various symptoms or manifestations of hypothyroidism. Next, you might be wondering, how did I get hypothyroidism? What are the causes of hypothyroidism? The most common cause of hypothyroidism is Hashimoto's thyroiditis or autoimmune thyroid disease. In this, the immune cells attacks the cells present in the thyroid gland, as a result of which these cells are unable to make thyroid hormones. So there is less hormone production or absent hormone production due to the attack of immune cells over the thyroid gland. Apart from autoimmune thyroid disease, other causes of hypothyroidism are people who underwent radiation to the neck due to other conditions, people whose thyroid gland has been completely removed, or if they are on certain medications and these medications can cause damage to thyroid hormone synthesis process. One more important cause of hypothyroidism is thyroiditis, which stands for inflammation of your thyroid gland. This inflammation can happen due to a viral infection or it can be due to a part of autoimmune condition. So during the phase of inflammation, there won't be production of thyroid hormones. One more important cause of hypothyroidism is congenital hypothyroidism. Here, in children, there is no production of thyroid hormones from the thyroid gland. This can be due to a defective mechanism in thyroid hormone synthesis, or the thyroid gland has not formed at all. Whenever you have these symptoms and you meet the doctor, the first step the doctor does is physical examination. Here, the doctor asks you to extend your neck and the doctor palpates your neck to see whether there are any irregularities, any swelling in your thyroid gland. By doing this, the doctor will come to know whether your gland is enlarged or fairly in normal size. The doctor will request for following tests: TSH, which stands for thyroid stimulating hormone, free T3 and free T4. These are the blood tests. These blood tests are easily available in most of the laboratories and hospitals and clinics. Based upon the levels of these tests, your doctor can be able to say whether you have a normal thyroid function or hypothyroidism. In people suffering from hypothyroidism, thyroid hormones are less. That means your T3 and T4 levels are low. The TSH levels are high. Normally, the TSH levels varies between 0.4 to 4.5. However, in hypothyroidism, your TSH level can be above 4.5. In extreme form of hypothyroidism, the TSH level can go above 100 also. in some special conditions, we ask for additional tests known as antibody levels. These antibody tests are TPO antibody or thyroglobulin antibody. Basically, if these antibody levels are high, it gives us the clue that the person is suffering from autoimmune thyroid disease. In some scenarios, if there is swelling of your thyroid gland, we ask for ultrasound of your thyroid gland, basically to see whether there are any nodules, what is the shape and size of your thyroid gland. After knowing about the various methods to diagnose hypothyroidism, next coming to the treatment. Here we know that the thyroid gland is not producing sufficient hormones, so the main form of treatment is thyroid hormone replacement therapy. Here we give thyroid hormone in the synthetic form, basically in the form of tablets. So these thyroid tablets are extremely safe without any side effects. It's just like taking the hormones which are deficient in your body. Thyroid tablets comes in various brands. The commonly available brands everywhere are Euthyrox, Eltroxin, Thyronorm, etc. etc. This thyroid tablet comes in various doses: 25 mcg, 50 mcg, 75 mcg, 100 mcg, 150 mcg. Thyroid tablet needs to be taken daily, one in the day. The most important instruction which doctor give to the patient is that thyroid tablet needs to be taken as soon as you wake up in the morning in the empty stomach. The stomach should be empty for at least 8 to 10 hours. After taking the tablet with the water, you should not take your next food for at least 45 minutes to 60 minutes. Why? If you take thyroid tablet along with food or tea or coffee or along with some other medications like calcium tablets, iron tablets, gastric medicines, all these food and tablets can impair the absorption of thyroid medications. So you may not get the full effect of the thyroid medicines. Your thyroid levels may not come under control, or in sometimes your thyroid levels might be fluctuating. After taking the tablet, your doctor will usually ask you to do a follow-up test after 6 to 8 weeks to know that whether the thyroid levels have come back to normal. Basically, in follow-up, we do TSH and free T4. After knowing about the hypothyroidism, let me talk about some important special scenarios, that is, pregnant women. In pregnancy, the thyroid levels needs to be checked once in every 4 to 6 weeks because during the early part of pregnancy, the thyroid dose needs to be increased by about 25 to 30% depending upon your TSH levels. So with this, let me come to my end part to summarize hypothyroidism, which means underactive thyroid gland, various symptoms, common causes, tests to diagnose hypothyroidism, and the treatment, that is thyroid hormone replacement therapy. With this, I hope your doubts about hypothyroidism has been answered. Still, if you have any questions, you can write it in the comment section. Thank you. See you soon in the next video.